Better Health for Individuals Part B by Eren Manav from Year 11. The Ottawa Charter. In 1986, the first international conference on health promotion took place in Ottawa, Canada, as a response to the emergence of the new public approach towards health. The Ottawa Charter framework for health promotion covers all aspects of health. The areas the Ottawa Charter targets to improve health are developing personal skills, creating supportive environments, strengthening community action, reorienting health services, and building healthy public policy. The Ottawa Charter framework for health promotion targets all areas surrounding health promotion. It tries to improve all aspects of health within individuals. My chosen health organisation that is promoting better health for individuals in Australia is Headspace, a National Youth Mental Health Foundation. Headspace is a National Youth Mental Health Foundation providing early intervention mental health services to 12 to 25-year-olds, along with assistance in promoting young people's well-being. This covers 4 core areas: mental health, physical health, work and study support, and alcohol and other drug services. Headspace undertakes a range of activities to increase the awareness of our services and how to access them among young people, their families, friends, and the broader community. Information and services for young people, their families, and friends, as well as health professionals, can be accessed through this website. Headspace centers online counseling service Headspace, prevention suicide support programs, Headspace school support. This is information from the Headspace website. This information from the Headspace website shows who Headspace is and how they promote health. The first framework of the Ottawa Charter is developing personal skills. Headspace develops personal skills by providing individuals access to trained mental health professionals who help by giving advice and issue ways to lead the direction of positive health, provide information and service for young people, their families, and their friends, include statistics on young suicide amongst young people and ways of prevention. Headspace is also involved in multiple activities to raise awareness and ways to access their services. Centers in metropolitan, regional, and rural areas of Australia for young people, families, friends, and the community to acquire knowledge through psychologists, social workers, alcohol and drug workers, counselors, vocational workers, or youth workers are also available. Headspace also provides youth with friendly general practitioners, GPs, and health nurses who can help with any physical health issues. A GP can also help you with issues related to contraception, sexual health, drug or alcohol use, relationship problems, or feeling down or upset. So Headspace provides youth with general practitioners who are there for youth to ask questions to develop their own knowledge on a certain topic, which can then develop and improve the health of the youth if they're feeling down in mental health or physical health or even social health. The second part of the Ottawa Charter framework is creating supportive environments. Headspace creates supportive environments as they have centres which are located in metropolitan, regional, and rural areas across Australia, which come with face-to-face advice, support, information, and services for young people, provides ways in which friends and families can help someone they know who is suffering with depression. Health professionals can be accessed through their website, their centres, their online counselling services, eHeadspace, and their suicide prevention programs. eHeadspace offers support 7 days a week. eHeadspace also holds monthly online information sessions where you can join group chats. Headspace creates supportive environments for youth as they have centres located in many areas across Australia, and they provide services for young people, which develops and increases their ability to make health promoting decisions and choices in these settings. The third framework of the Ottawa Charter is strengthening community action. The Headspace website says a number of targeted national campaigns help Headspace talk to hard-to-reach groups such as Aboriginal and Torres Strait Islander young people, and encourage them to access support at Headspace or other appropriate mental health services. The website also says that Headspace School Support works with schools in Australia to prepare for, respond to, and recover from suicide. Many people help Headspace by volunteering their time for fundraisers, donations, and by offering their services in their centres. Campaigns in rural areas to encourage Aboriginal and Torres Strait Islander youth to access the support on the Headspace website. Headspace strengthens community actions as they have centres available across the country for youth to come there and to gain support by volunteers who come there to provide their services, whether it be drug or alcohol workers or general practitioners. Headspace also brings the community together by going out to schools across Australia and helping them with suicide and how to respond to suicide if it happens in schools. This creates a strengthened community by bringing together the public and schools. Reorienting health services, the fourth framework of the Ottawa Charter. Headspace aims to provide early intervention mental health services to 12 to 25-year-olds. The website says, by treating these issues early and providing a holistic model of support, the risk of them developing into more serious problems is greatly decreased. This is talking about mental health issues. The setting with which Headspace promotes health is when they go to schools for their suicide and nationwide Headspace support centres. They have teamed up with the Super Foundation to develop the Headspace Bullying Education and Prevention Resource Kit. Campaigns in rural areas to encourage Aboriginal and Torres Strait Islander youth to reach out and ask for help if they have any concerns about their health. Reorienting health services is basically the prevention of health issues becoming bad, which can turn into suicide when it relates to Headspace. Now, the way Headspace prevents suicide is when they go to schools to talk about suicide prevention and their support centres, as well as how they have made the prevention resource kit with Supre. These activities and campaigns encourage youth to talk out about their mental health issues if they do have any, which can then lead to the prevention of their health becoming bad, leading to their suicide, preventing all that from happening from the start or from early on in their mental health issues. The final framework of the Ottawa Charter is building healthy public policy. A quote from the Headspace website says, the suicide of a young person has a long and lasting impact on their friends and peers, their families, schools, and communities. Headspace School Support is a suicide prevention program which assists Australian school communities to prepare for, respond to, and recover from the death of a student by suicide. It is part of the suite of Headspace programs developed to promote mental health and support young people aged 12 to 25 dealing with difficult issues in their lives. To build healthy public policy, Headspace provides schools with guidelines in ways to assist Australian school communities to prepare for, respond to, and recover from the death of a student by suicide. So this means they are providing ways in which schools can follow to prepare if a student is feeling like suicide is their result, or to respond to if a student actually does commit suicide, and how to recover from a student committing suicide.